Hello, my name is Kenya Basden, and today we're going to talk about the Bazi Plague and the new diagnostic test that's available. The new diagnostic test that is available to identify whether a patient has the Bazi Plague is the Bazi IgM. It's a relatively painless exam and is inexpensive, especially when compared to the only other known diagnostic test at this time, which is an imaging test and requires an intravenous dye. We conducted a population-based study on individuals who had the disease and those who didn't have the disease, and when they tested positive, when they didn't. We found that there was a 14% prevalence rate of the population that actually had the Bazi Plague. The sensitivity of this test showed that 91%, there's a 91% probability that a patient will test positive when they are actually infected with the Bazi Plague. And this is also known as the likelihood that an infected individual will have a positive test result and how often you will correctly diagnose this condition. For the specificity rate, 15.7% is the probability that an individual will test negative when they are not infected with the Bazi Plague. This is also known as the likelihood of a non-infected individual getting a negative test result, or how often we would correctly diagnose a non-diseased individual as not being infected with the Bazi Plague. Keep in mind that 84.2% chance, there's an 84.2% chance of obtaining a false positive diagnosis or false positive test result. Given that the positive predictive value showed that 15% of people who developed the Bazi Plague after they tested positive for it, 15% of people who developed was the number of people who developed the plague after they actually tested positive for it. And the negative predictive value showed that there was 91.5% of people who did not develop the Bazi Plague after they tested negative for it. So overall, what this means is that a negative test result is actually quite accurate. And if a patient actually has the Bazi Plague, there is a high chance that they will be positive. However, if the patient comes back with a positive test result and they are not exhibiting signs or symptoms of the Bazi Plague, or you're questioning whether it is a Bazi Plague or not, consider further testing to rule out a false positive. Thank you.